I will now be introducing another component to the Safewards intervention, known as Know Each Other. A key component to mental health nursing involves forming good therapeutic relationships with patients. However, due to the nature of acute wards, with changing patients, shift patterns and the amount of paperwork nurses are required to complete, staff get very little time to build these relationships with service users. A way of facilitating this relationship building is to know some basic information about the patient that doesn't just focus on medical history, but also hobbies, interests, likes and dislikes. This also goes for staff members on the ward, who are often viewed just by their job title. This process then aids the establishment of therapeutic relationships on the ward, which form the foundation of staff being able to work effectively with patients during their admission. Know Each Other is an intervention that aims to facilitate this process. Staff and patients are asked to fill out a profile, covering hobbies and interests, favourite films, books, quotes and advice, along with other conversation-starting topics. Patients and staff can choose to share as much information as they feel comfortable with, although it is preferential to encourage more material for the profiles than less. These forms are then typed up and laminated, and kept in a folder in a public space on the ward, encouraging conversations and the start of new relationships amongst service users and staff. As with each intervention, staff will be responsible for collecting the information from staff and patients, and making service users aware of the intervention itself. This component may initially be met with some resistance, so it is important that staff and service users fully understand the benefits to the intervention and generate enthusiasm about the purpose. During the research trial, several staff members voiced not wishing to share personal information and were initially reluctant to complete their profiles. However, when reassured that they only needed to share what they felt comfortable with, staff became more accepting to participate. It was great to see that staff then realised they had shared likes and dislikes with patients they were treating, and this visibly stimulated conversations. Another factor that occasionally hindered the purpose of this intervention was that some patients were too unwell to complete the forms appropriately. Despite this, patients appeared enthusiastic about getting involved and were able to amend their profiles during their time on the ward as they were getting better. This then served as a good reflection tool for staff and patients to witness the progress they had made during their admission. A common barrier to the effectiveness of the Know Each Other folder was staff regularly keeping the folder in the office, rather than in a public space on the ward. This was often a result of patient in distress tearing the folder or throwing it on the ward. Although this initially appeared to be a strong implication to pursuing this intervention, staff were able to produce alternative methods of implementation. Rather than displaying the service user and staff profiles in a folder, wards created Know Each Other boards and clip frames, which were visible to all staff and patients. This appeared to be an effective alternative to ensuring implementation of the intervention. Staff offered positive feedback about Know Each Other on the whole, and implementation was continued after the research trial had ended. Wards are encouraged to implement this component in a method that best suits their environment, as to guarantee the purpose of the intervention is maintained. Once momentum is gained with this intervention, it is simple to sustain and can become a great icebreaker for new admissions and new staff members on the ward.